The liver is both an endocrine and exocrine gland. An exocrine gland is one which releases the secretions into the bloodstream with the help of the duct system. Those are the peculiar makes the liver a unique organ. And of course, you know the physiology that the liver has a lot of metabolic functions and plays a key role in the digestive system as well as for the endocrine system. That's why the name itself, the liver, shows that this organ is vital for life. Now we've learned about the regions of the anterior abdominal wall. And I told you we'll be using these regions to correlate the site of the abdominal within the abdominal cavity. So I've shown you the position of the liver in situ within the abdominal cavity, and the regions of the abdomen. So can you tell me, the liver occupies which region in the abdomen? The liver occupies the right hypochondrium, the epigastrium, as well as the left hypochondrium. This is to show you how the liver occupies each of these above mentioned regions. Now let's look at the borders and surfaces of the liver. This witness once the anterior abdominal wall is reflected. So naturally, the surface that you view first, this wide area, is the anterior surface of the liver. Superiorly, the liver is related to the thoracic diaphragm. So the superior surface of the liver is the surface that is related to the thoracic diaphragm. And since the liver is a large organ, this large area of the liver, which occupies the right hypochondrium, this surface of the liver is called the right lateral surface. So in anterior view, these are the three surfaces of the liver. Clear border of the liver, which is labeled here. It is the inferior margin or the inferior border. So the surface that you're viewing first anteriorly, this is the anterior surface. Whereas inferior to the liver, you see the gall being marked. In that plane comes the inferior surface of the liver. So there is a sharp margin between the anterior surface and the inferior surface of the liver. The inferior border is having clinical importance because on examination of the abdomen in the clinics, the doctor will be palpating or trying to feel and examine the inferior margin of the liver, because the rest of the liver is protected by the ribs. In case of any enlargement or any mass in the liver, it is the inferior margin which can be palpated, which can be felt, and the doctor can assess if there is any gross pathology in the liver. This large area on the posterior view of the liver, this large area with a lot of impressions made by the other abdominal organs, that is called the inferior surface or the visceral surface. As I had mentioned, there is no clear distinction between certain surfaces in the anterior view. So the anterior surface, the superior surface, the right lateral surface, and the superior most portion of the posterior surface. They are all continuous with no clear demarcation. So we call all of these surfaces together as diaphragmatic surface of the liver. When you look at the anterior surface, you can see there is a prominent ligament, which is named the falciform ligament. This ligament is very important because it divides the liver into a right lobe and a left lobe. This is the anatomical division of the lobes of the liver. If this is the sagittal section to show the abdominopelvic cavity, this is the liver and the anterior abdominal wall. So from the supraumbilical portion of anterior abdominal wall up to the anterior surface of the liver extends this sickle-shaped ligament called the falciform ligament. And at the lower portion of falciform ligament, that is the free margin of falciform ligament, there is another rounded, thick ligament called the ligamentum teres of liver. Round ligament. Okay, the word teres means round. So this is called round ligament of the liver. So this is a dissection specimen. If this is the liver and the anterior abdominal wall is reflected, what is labeled as F is the falciform ligament. And at the free lower margin with a white arrow, what is pointed is ligamentum teres. This ligamentum teres will further continue on inferior surface of liver as well. That we will see soon, how the ligamentum teres is positioned on inferior surface of this organ. Now, let's look at the relations of the superior surface of the liver. So superior surface of the liver, it is closely related to the domes of the diaphragm. In the central portion of the diaphragm, there is a tendon called the central tendon. And this central portion of superior surface of the liver between the right and left lobes is known as cardiac impression of superior surface of the liver. Since the pericardium is related to the central tendon, now let's look at the relations of the right lateral surface. In this diagram, this region that I am pointing is the right lateral surface. We can divide the right lateral surface into an upper 1/3, a middle 1/3, and lower 1/3. So the upper 1/3 of right lateral surface is related to the right lung, okay, the diaphragm and the right lung. The middle 1/3 is related to the right costodiaphragmatic recess, whereas the lower 1/3 is related to the liver is related to many folds of the peritoneum called the peritoneal ligaments. One ligament I've already mentioned on the anterior surface, which is the falciform ligament. When you trace the falciform ligament up to the posterior surface of the liver, you can see that the falciform ligament will continue as coronary ligament. Specifically, this is superior layer of coronary ligament. And the coronary ligaments will further continue as a right triangular ligament for the right lobe and left triangular ligament for the left lobe. So these ligaments, the coronary ligament and the triangular ligaments, they connect the liver to the thoracic diaphragm. In posterior view, this will be the left side of the liver. This is the left triangular ligament. And here is the right triangular ligament. Now please look carefully. There is the superior layer of coronary ligament. and inferiorly here is inferior layer of coronary ligament. Okay, now next question. You had a class on the stomach. This is the lesser curvature of the stomach, and this is the liver. So what is the name of this peritoneal fold between the lesser curvature of stomach and the liver? Can you name this peritoneal fold?
Lesser omentum.
Yes, good. This is the lesser omentum. So lesser omentum is having an attachment inferior surface of the liver. So lesser omentum is attached to this region on the inferior surface. This region is known as the groove for ligamentum venosum. And here you can see there is an area where structures enter the liver and they leave the organ as well. So this region is called the gateway of the liver, or it is called porta hepatis, L-shaped attachment of lesser omentum on the inferior surface of the liver. And one word about true ligaments of the liver. Okay, on the inferior surface, what is labeled here? This vertical area is the groove for ligamentum venosum and ligamentum teres. If you look closely near porta hepatis, ligamentum teres as well continues on the inferior surface of the liver. Okay, ligamentum teres is from left umbilical vein, and ligamentum venosum is formed from ductus venosus, going to deal with the posterior surface of the liver. Okay, in posterior view, this outermost portion is called the posterior surface. First, I will name that you are going to see from the right side to the left side in order. The unique features of the posterior surface are the bare area of the liver. Next, there comes a groove for the inferior vena cava. To the left of that is a lobe of the liver known as the caudate lobe. There is a groove for ligamentum venosum. And finally, there is an esophageal area. This is where the abdominal part of the esophagus is related to the liver. Bare area of the liver is triangular in shape. Okay, here is the base and here is the apex. The base is formed by the inferior vena cava. What about the apex? What is the ligament forming the apex of the bare area? The right triangular ligament. Very good. And the other boundaries are very simple. It is just the superior layer of coronary ligament and inferior layer of coronary ligament when we take the sagittal section of the abdominal cavity. Okay, this is the liver, and here is the bare area, the posterosuperior region of the liver. So in certain conditions like liver abscess, amoebic liver abscess, sometimes when the abscess is very large, it can rupture and the microbes can travel from abdominal cavity through the diaphragm, and the infection can spread to the base of the lung as well. Spaces underneath the diaphragm called subphrenic spaces. The space related to the bare area is called the right extraperitoneal space. And bare area is also a place where there is communication between the portal vein and the systemic circulation. That's the area for portosystemic anastomosis. You saw the position of inferior vena cava at the base of the bare area. So the inferior vena cava is connected to other veins within the substance of the liver, which are the hepatic veins. So how is this organ being suspended in that position in the right hypochondrium, epigastrium, and left hypochondrium? What are the structures which will help to stabilize the liver in that position?
Peritoneal ligaments.
Yes, peritoneal ligaments is one factor. Any other?
Hepatic vein.
Yes. See, this inferior vena cava is a great vessel which is present in the abdominal cavity. So these hepatic veins, when they enter into the inferior vena cava, that also gives a degree of support to the liver. Yes, thank you. That's a good answer. Now, the peritoneal ligaments, you may think the peritoneal ligaments are greater in number, so it gives a lot of stability to the liver. But actually, the peritoneal ligaments are false ligaments, so it only gives a small degree of support to the liver. The greater support is given by the hepatic veins and also by the pressure given to the liver by the surrounding abdominal viscera. Now we will look at the caudate lobe of the liver. Okay, so based on this diagram, can you tell me the boundaries of caudate lobe? To the right side is inferior vena cava. Good. What about on the left side? On the left side is the groove for ligamentum venosum. And inferiorly here, there is the porta hepatis. You yourselves know, if you know this diagram, it is very easy for you to just name the boundaries in your own words. Now, the caudate lobe also has an elongated process towards the right side, which is called caudate process. And there is one more small projection on the caudate lobe, which is called papillary process. The grand finale of today's class, which are the relations of the visceral surface of the liver. To learn these relations, you just need to have an idea about the position of the intra-abdominal organs. The stomach, which will lead to the first part of duodenum as well. Yes. What is this organ? Any guesses?
Pancreas.
Yes, very good. The pancreas. Good. Now, on inferior surface of the liver, here, there's one more organ. This belongs to the extrahepatic biliary apparatus here. This is the gallbladder. Yes, good. The gallbladder. Posterior abdominal wall, there is the right kidney and right suprarenal gland. Okay, posterior most portion of the abdominal wall. What about this part of the large intestine? Is also coming as a relation, right colic flexure, or it's also called the hepatic flexure. Good. So you see, these are the organs which will form the impressions on inferior surface of the liver. Okay, seeing this diagram, the liver has been retracted superiorly from its anatomical position. This is the visceral surface. Fundus, this is body, pylorus, which will continue into the first part of duodenum. Yes. Then here will be the position of the pancreas. I just want you to learn one word related to the pancreas, which is tuber omentale. Okay. Then we learned there is the right kidney and the right adrenal gland in the posterior abdominal wall. And also there is the right colic flexure. So I'm just showing you have to keep in mind this. When we are looking at the inferior surface, we are going to view the liver from the posterior aspect. Okay, this is the posterior view of the liver. So right now, I've shown you the anatomical position of the other intra-abdominal organs. But when you are learning the impressions on the inferior surface of the liver, all of these organs will be like a mirror image, okay, something like this. Okay, So we learned about esophagus, fundus of stomach, body of stomach, pylorus, and the duodenum. Okay, you just think about this a bit, you will understand how these impressions are getting formed. So you know the parts of the stomach now. So let's look at how the impressions are being formed. Okay, so inferior surface of the liver. See, look, this is the area for esophagus, which is actually on the posterior surface. This is the area for fundus of stomach. This is the gastric area, the large area, gastric area. Specifically, it is for anterosuperior surface of body of stomach. And further, when you travel, there'll be an area for relation to the pylorus and to the duodenum as well. Anterior surface of liver, we learned that falciform ligament divides the liver into right and left lobes. That is on the anterior surface. Whereas when we come to the posterior view, this ligamentum teres and ligamentum venosum will divide the liver into right and left lobes. Okay, this gastric area, does it belong to right lobe or the left lobe of the liver?
Left.
Lobe? Yes, the left lobe. Good. You all know that the stomach is on the left side of the abdominal cavity, and the gastric area is on the smaller left lobe of the liver. Okay, now just look at the position of the right kidney and right suprarenal gland. Okay, so here is the renal area and a suprarenal area. And finally, lower down here, there is an area related to the right colic flexure. That is the colic area. And here there is a groove for gallbladder as well. There is a quadrate lobe on the visceral surface of the liver. So can you tell me what are the boundaries of quadrate lobe? Yes, to the right side is the gallbladder. Very good. What about to the left side? Fissure for ligamentum teres. Good. What is present superiorly? Here, the area where structures enter and leave the liver. Yes, superiorly is porta hepatis, and inferiorly here is inferior margin of the liver. Okay. Finally, structures at porta hepatis. Okay, just for your easy memory. From anterior, okay, when you're looking at the liver from posterior view, anterior area will be here, and near the inferior vena cava is the posterior aspect. From anterior to posterior, the structures at porta hepatis are, okay, bile duct, artery, which is the hepatic artery, and vein, which is the portal vein. Okay, so it's duct, artery, vein from anterior to posterior. If you know the name David, it's DAV are the structures from anterior to posterior at porta hepatis, which is related to the gastric area. There's one more small portion here called tuber omental. Now this portion, this is tuber omental of the liver, which is related to lesser omentum and to tuber omental of the pancreas. In the left lobe of the liver, these are the two impressions, and the rest of the special features and impressions that we learned, they all belong to right lobe of the liver. Yes, thank you class for your patient listening.